Mr. Speaker, in the last election, the NDP promised to create 2,000 public long-term care beds. Now, depending on the day, the health minister says either it's already been done or that they're well on their way. Now, most of the beds that have been created came about as a result of the 2014-15 ASLE program that this minister first delayed and then proceeded with. So to the minister, as I asked in estimates and have not yet received a response, what is the number of public long-term care beds that have been created since you took office, and where are they located?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I think I recall the day where the member's referring to me potentially misspeaking, but I want to assure all Albertans that our commitment to build 2,000 long-term care and dementia spaces by 2019 is well underway and that we're on track to achieving that. In fact, since coming into government, we've approved approximately 3,002, well, I guess that's not approximately if it's 3,002, net new long-term care and dementia spaces. That includes beds which will be completed beyond 2019. The three public builds are Calgary, the complex care there at Bridgeland, Norwood here in Edmonton, and Willow Square, of course, in Fort McMurray. Those will be completed after 2019, but they are well underway.
Supplemental.
Well, Mr. Speaker, let's take a look at those. Given that the vast majority of long-term care beds are a result of the government simply completing ASLE projects that were already planned or underway under the previous government, and given that those beds were built at an average cost to the taxpayer of $65,000 per bed, and that this government's three projects that the health minister just mentioned will create 489 new beds at a projected cost of $587 million, or $1.2 million each. To the minister, why are the long-term care beds created by your government 18 times more expensive?
The Honourable Minister of Health.
Thanks. I believe I also committed to tabling the math because I think there's some creativity happening by members who keep asserting those numbers. So we are working to ensure that we do that, Mr. Speaker. The former Conservative government made a lot of promises without actually budgeting or signing any contracts. When we came in as a government, we made sure that their empty promises became actual projects. We moved many of those beds up from being lower levels of care to being long-term care or dementia care beds, and many of them are open. For a fact, I toured St. Teresa's, I always want to say Mother Teresa, but St. Teresa's in Calgary just on Friday, and the staff and the residents who are there are in very good hands, Mr. Speaker.
Thank you, Honourable Minister. Second supplemental.
Well, Mr. Speaker, given that in this time of fiscal restraint, strategic partnerships with non-profit, faith-based and private continuing care providers would maximize every taxpayer dollar, and given that many Alberta communities are desperate for additional continuing care spaces, but the government's current building projects have resulted in skyrocketing costs, to the Minister of Health, will the minister inform Albertans whether future projects will be built using a cost-effective partnership program like ASLE, or will she continue with the government-only projects that are astronomically more expensive and provide a tiny fraction of the number of beds?
The Honourable Minister of Health.
Mr. Speaker, I'm proud of the fact we're building almost 200 net new beds in Calgary for complex patients who are some of the most challenging to care for. We're also building 350 at Norwood, which I think is important, 145 net new for, again, patients who are some of the most hard to care for and who regularly find that they aren't welcome in other facilities, Mr. Speaker. It's important for us to build a variety of types of options for the people of this province, because nobody should be living in a hospital bed or receiving care that isn't appropriate. For folks who are receiving the most complex care, we need to make sure that they have those options as well, Mr. Speaker. So I'm not going to apologize for building beds for those who are...
We're done. Honourable Member. Calgary West.